Hello, everyone. Welcome to Feedstuffs 365. I'm Sarah Muirhead. For producers, veterinarians, and government agencies, early detection can allow for better management and decision-making when it comes to outbreaks such as avian flu. With us today to talk about a new handheld device that's shifting the paradigm of testing, monitoring, and reporting for the early detection of pathogens is Shaun Holt, CEO of Alveo Technologies. Welcome, Shaun. Thank you for joining us here today.
Well, thanks for having me again, Sarah. It's a pleasure to see you again. And
good to see you. For those of you that are tuning in, thank you for being here. And if you have any questions for Shaun as we move through this interview, please feel free to post those there in the chat on the side of your screen or in the social media channel that you are viewing us in. So, Shaun, let's start by having you give us a general overview of the company and what it is, the technologies that you folks work in.
Yeah, absolutely. So we're a molecular diagnostic company, and we have developed a platform technology to detect essentially any pathogen, working with really any sample type that we call the point of need. So we're really trying to drive towards a decentralization of molecular testing, taking what has been traditionally done in lab settings with expensive equipment and highly trained personnel, taking that testing out of the lab, putting it at the point of the need where actionable outcomes and data is achieved earlier, pathogen detection is achieved earlier, and decisions can be made much quicker in terms of whatever action is needed, right? And so we've deployed this technology now. Our first product is around bird flu testing, supporting the poultry industry. So we're very much, while we're molecular diagnostics and there's broad applicability, especially in human in vitro diagnostics, it is a platform. We're very focused in this sort of One Health continuum because of the broad applicability. So we're not only focused in animal, but also human-based testing, as well as environmental and industrial-based testing. And so we're able to do that because we developed this handheld, portable, rugged, device that can test for all these different pathogens. And really the only thing that changes between any of these sort of markets, applications, use cases, the only thing that changes with our platform is the chemistry and the reagents that go onto it. So it's a really, really cool device, highly differentiated, very accurate and very affordable, I would say as well.
So how exactly does it work? You said it's a handheld device. Do they scan something? How does that work? And how long does detection take? Is there a standard detection level, or does it vary by what you're trying to accomplish?
Yeah, I mean, results can really vary in terms of time to result, including sample preparation from as fast as 12 minutes up to 45 minutes or so. On average, we like to say it's about 30 to 35 minutes. It really is dependent on the number of tests or pathogens that you're trying to identify in a single run, how complex that pathogen is, and other factors. But in general, it's about 30 to 35 minutes on average. Faster or slower depending on complexity. And repeat the second question.
It was just how does it work? How do you use it? How does the technology? Are you scanning something or?
Yeah, thank you. So
how does that work?
Sure. Very easy to use, very simple workflow. I like to use the example of bird flu and poultry. So the sample collection is either a tracheal or oropharyngeal swab from the throat, or a collateral swab from the backside of the bird. We do pooled samples, so you can actually test between 5 and 10 birds in a single test, a single run. That sample is collected with a swab, input into a filtration mechanism, very, very easy to use filtration device, and then pipetted into the cartridge. We have a cartridge that's about 3.5 inches by 2 inches. A very small sample is input into the cartridge. Cartridge is shoved into the analyzer, and you're off and running. A mobile device or a tablet or a PC walks you through very easily the workflow. So, in that regard, very little, if any, training is required at all to run the device. And we work with all types of sample types. Human sort of nasal throat swabs, even eye swabs. Obviously, poultry and other sample types we're working with as well. But
yeah, because you've been working recently with CDC to develop a test for avian influenza in humans, because we know we've seen some of that transfer, and I'm sure that's important for us all to start monitoring when we see situations like that. But so tell us why, though, from a One Health scheme of things, why is that so important?
Sure. So I think you have to start with 70-75% of emerging infectious diseases sort of begin in animals. So that is really Alveo's strategy. Is first and foremost, we're agriculture focused, although we have broader applicability like we covered earlier in the session. So the CDC, and rightly so, is looking to get out in front of a potential human health crisis, right, with the bird flu and poultry and cattle, and I think we're pushing close to 30 plus other mammalian species have contracted the bird flu virus. It's a potential human health crisis. And so at the CDC put a call to industry out, working with industry partners to essentially increase the capacity of bird flu testing in humans, such that if the disease becomes transmissible, the testing capacity is there. And I'm talking about centralized lab testing, but taking that a step further, point of care testing for bird flu. And so that's been a great partnership. We have largely developed that test, leveraging, our expertise in bird flu and poultry, and bringing that over to support, the human health approach. So it really is the One Health, continuum, as you mentioned, where, animal health, and there's quite the intersection between animal and human health, put it that way. And so we're working on both.
It's a lot easier to swab a human's throat than a chicken's throat too, I bet, huh?
Very much so. And you're only swabbing, the nasal passage in the eye, thankfully.
There you go. So now your technology, it has other uses on the farm and in clinics and manufacturing plants that prevent and limit the impact of viruses, fungi, bacteria, and other pathogens. What does this ultimately mean in a grand scheme picture from the standpoint of risk reduction, animal health, and even food safety?
Yeah, great question. Because of the ruggedness, the portability, the ease of use, the fact that we can test for many different things in parallel, at affordable prices, and we're talking about molecular-based testing, right? Given all of those factors, the platform is broadly applicable. And to your question, yes, I mean, we've got human health applications. We've obviously got bird flu, and we're going to continue to build out the poultry diagnostics portfolio. We've got partnerships in, crop protection as an example. And these are industry leaders in terms of partners that we have established. Fermentation processes, and even looking at companion pet diagnostics. So to your question, the value proposition is actually very similar across each one of these markets. In general, we're talking about earlier detection, improving outcomes. And then from there, market by market, the value proposition sort of differs. In crops, you're talking about improving yield. In livestock, again, you're talking about improving yield. For the consumer, you're talking about impacting the supply side of the equation, so helping to reduce egg prices, helping to increase the supply of eggs on shelves, because you're detecting earlier. So you've got a surveillance aspect to this, but you also have the aspect of, if you're finding positives earlier, you can react you can take increased biosecurity measures and therefore preventing the spread farm to farm, county to county, state to state. So it really is improved outcomes, whether it's yield, increased supply, cost savings, cost reduction, or in the case of animal and human health, improved health outcomes. That's what we're talking about here.
So what's next in the area of testing technology? What other applications are in the works? Are there any that you can, tell us about?
Absolutely. Yeah. So, obviously with our bird flu test in poultry, we're heavily focused on, making an impact in the poultry industry. So, beyond bird flu, we're developing the next set of, poultry diagnostic panels. I won't go into the specifics there, but if you look at the viruses that impact the poultry industry the most beyond bird flu, that's what we're working on. We would like to move beyond poultry, continuing in livestock. We've got other panels that we are developing with partners focused in swine, and we've got some early programs in cattle. And so we'd like to expand the livestock portfolio. We also have, with our partnership program, we've got a lot of exciting partnerships in the works beyond livestock in human health, again, in crop protection, fermentation, companion pets. I mean, it really runs the gamut of this One Health initiative. Beyond the new panels, we're really focused on innovating around sample preparation. So the ability to collect samples and process samples, not only from throat, nasal, eye, cloacal in birds, but blood, urine, feces, and other sample types. And that really will open up the capabilities of our platform to address even more of the challenges that the world faces in terms of disease spread. Because, if you look at the data, viral outbreaks, particularly internationally, have become much more prevalent over the years. And we want to help, solve that problem, focusing in animals, also partnering to help bring molecular diagnostics to, low and middle income countries. So we have some exciting programs there as well as in terms of human health in the element countries. So we're doing a lot with a little, as I say, as the CEO.
Yeah, lots going on. So what key takeaways do you want to leave our audience with today?
Yeah. Well, so we put a lot of focus on bird flu in this conversation, and so I think the key takeaways there is the solutions exist. We have products that serve the poultry industry today. We have a bird flu test that detects all of the high path strains of avian influenza in poultry. We're selling and shipping product across Europe, the Middle East, and soon Asia. I think the biggest takeaway is this is a problem that the USDA is heavily focused on solving. The new administration is heavily focused on solving. There's capital behind it. The USDA, I believe, is prioritizing, bird flu submissions, which is great. They have, just like we talked about with the CDC, come out with this call to industry to start to fund innovative solutions to help solve the bird flu crisis as well here in the United States. And so I think with the government focus, with the USDA, making this a priority, with the industry driving government and the USDA for new innovative solutions, I think that very quickly here we'll be able to see, the light at the end of the tunnel. Meaning, the setbacks with our farmers, with an outbreak and culling, you're looking at 6 to 9 months, generally speaking, to get back up and running. Mm-hmm. And there's obviously a huge cost to that, not only with the culling, but replacing inventory and getting back to production, right? And I think, that's for the farmer. And then for the consumer, making egg prices, more affordable. It traditionally has been one of the lowest priced, proteins in the human diet. And we'd like to get it back there. We'd like to do our part in doing so. So
Lots going
that's
on.
the key takeaway is I think that soon here we're going to see the light at the end of the tunnel with all the focus and the effort and the investment that's being put in, and the fact that solutions exist today, like Alveo, obviously.
Right, of course. No, that's great. Shaun Holt, CEO of Alveo Technologies. Thank you so much, Shaun, for joining us here again today.
Always a pleasure, Sarah. Thank you for having me. I really appreciate it.
And for those of you that have tuned in, we appreciate you being with us as well. For Feedstuffs, I'm Sarah Muirhead.